Okay, so again, you're assessing in one position. You're then attempting to restrict treatment to one position for the technical skill development, not because it's the best way. Okay, so we're going to focus on the thoracic region. Okay, I want you to side bend to your left the best you can. Good, and side bend to your right. So that may not be as visible to you guys. The side bending to the left is good, side bending to the right not as good. Could you sort of see that? Okay, the low T-spine when side bending to the right, you'd agree right around here there's something? Yeah. Yeah. Okay, we'll have you twist to the left, right, and twist to the right. Yeah, so when you twist to the left, it's okay. When you twist to the right, again, it's right around here. Okay, so we're talking low T-spine in this situation. So we're going to make it difficult. We're going to try to treat this in supine. So this violates the concepts of patient positioning where you want to choose the patient based on the anatomy being free, exposed, free to move in the planar planes required, and preferably visible. So this is basically violating all of that. So I'm making it as hard as I can on myself with respect to that concept. We'll have you on your back. Okay, so it's the right side. Okie dokie. So you'll, you know what? Flip your head up there, just so it's a little bit more visible. Come on. Right, so, and the reason I want to do it on this side is because otherwise you guys are just seeing my back, right? So in this case, I'm thinking low right side of the T-spine. So the things that I have to access that are going to be the arm as leverage, right? The ribs as leverage, or the legs as leverage. Because it's lower down, my prediction would be that I'm more likely to be able to get it with the legs, a little bit less likely with the arms. I'm thinking about generating right rotation and right side bending. So if I was thinking about that, I could use the leg, the opposite leg to pull across. I could use the opposite arm to pull across. So I want to start to try to figure out which one of these is going to work better for me. I don't want to make the assumption, I want to try it. So that's the most important part. So what we're going to have you do is bring this hand up, just so it's a little bit more exposed. You know what? Put it over there, right? So I'm going to come underneath. I'm going to do a more local assessment. So I'm just lifting like this to try to figure out there-ish, right? There feels okay-ish. Yeah. Like I'm poking you in the ribs, so it doesn't feel great. That's fair. But like that feels like it doesn't move, right? Okay. So give me this wrist. Thank you. So now I can pull towards me. I can see what that does for me, right? Bend this knee. Doesn't really do it, right? Yeah. Right? The other one does it. So let that down. Bend this. Okay. So I'm going to try this. Nothing, right? Okay. So let that down. So now I know it's going to be the arm. So bring that back to me. Thank you. Now with the hand under the back, like you see, I can push into the ribs. So now I'm using both, right? So like this, you feel something on it. Fair? Mm-hmm. It's a little awkward because your shoulder's like in your neck. You're like, blah, blah. But now when I push, so you'll see that through her shirt. You can see that? So now I've stacked both planes. But I know that I'm more likely to get it from this because I checked. I assumed that because it's lower in the ribs, I'd get it, or lower in the T-spine, I'd get some of it with the leg because it's closer, it's the closer lever, but it didn't work. So I always test. I don't necessarily make the assumption or stick with the assumption that this should work. Like, nope, it didn't work, okay? Right, now what I'm gonna have you do, push your left leg straight down and relax, and that connects right into it, right? Yeah. And then the right leg, and that doesn't. Feel the difference? Mm-hmm. So this is where I have to check because, well, it's on the right side, so when I activate the right side, it should work. What works is what works after you checked. Okay, push the left leg down again and relax. And if you look at her shirt, you'll see a bunch of this collect. Push your left leg again and let it relax. And I can't get a ton more here, so I got to do this. There you go. Go again, left leg and relax. Good, left leg and relax. See, that felt different?
Yeah, it feels good.
Yeah. Push the left leg again and let it relax. See how it's softening up, like it's not connecting as much? You don't feel it as much when you push the leg, right? Mm-hmm. Okay, push the left leg again and let it relax. Good. Push the right leg now and relax. So you felt that, now you felt it wiggle more with the right leg. Mm-hmm. It was like it wiggled over it. That's a reasonable description?
Yeah.
Yeah, fair enough. Okay, push the right leg again and let it relax. Good. Come back. I'll redo my local test so my hand didn't move. Feels easier. Mm-hmm. Okay. So it feels easier to her. It feels easier to me, right? Sit up and face that way. So I rerun the same test. So just so you can see with not being on the camera. My hands are kind of like this, just at the top and the bottom. Okay, bend to the left because it's the good way. Fantastic. Bend to the right. Does everybody see that difference? That's visible. Twist to the left. Great. And twist to the right. There you go. And that feels easier, right? Yeah. Okay, so always check with what's going to connect, what's going to work, and recheck it as you go. So I assumed, because I said it out loud, I assumed more likely that the leg would do it. Leg did nothing. I got both planes. I used a short lever hand and a long lever hand. When you're trying to do rotation in supine, especially with the torso or even with the leg, pull towards you. So grab the thing on the opposite side and pull towards you. Don't push away. Pushing away is much harder on you because you're taking the effort and load further away, whereas when you pull, the effort and the load are coming closer together. So it's not about where you're strong, it's just about bringing the load closer to you, right? That's the best way to explain it. It's also the same thing when people talk about make sure you lift with your legs, not with your back. It's the dumbest way to say it. Because no matter what you do, you have to use everything if you're lifting something up. Bring the load as close to you as you can. Don't deadlift out here. Deadlift against your shins is a reasonable way to say it. So you're trying to approximate effort and load. That's why you pull instead of anything else. 1 second. Good. That's good.